Avenue, and I am a PN student at Wilson State College. And today I'm going to be demonstrating how to do a postpartum assessment on a mother who delivered 24 hours earlier. So I'm going to enter the room. I would knock first, provide privacy. Hi Shirley, my name is Sarah, and I'm going to be your student nurse today. We're going to be doing like a head-to-toe assessment just to see how you're progressing after delivering your baby. So how are you feeling? Are you in any pain? You are. So on a scale of 1 to 10, how do you rate your pain? You're at about a 5. Okay, and what would be an acceptable level for you? Like a 0 to 2, okay? And can you tell me where your pain is at? Lower abdomen, all right. And can you describe like the nature of that pain? Like how does it feel? It's kind of cramping. Okay, is there anything that makes that better or worse? So the ibuprofen earlier helped, okay. So I will be sure to check the medication record and see when you had your last dose and see if it's time for that. And I see you had your catheter out, and we already did your vitals. Your heart and lungs sound good. Everything's good. So is it okay with you if I have your family leave just so we can have a little, so I can get you checked? Okay, good. So family's out of the room. I've provided privacy. So we had your catheter taken out, and are you having any problems voiding? No, you just went? Okay, great. Any discomfort with that? A little burning? Yeah, that's pretty normal. So that little water bottle that we gave you when you go to urinate, just kind of spray a little warm water on it while you're going to the bathroom, and it'll help ease that discomfort. So what about have you had a bowel movement yet? No? Okay, so what about any passing gas? You are able to pass gas, all right. So we can get you a stool softener to help move things along. That is very normal after giving birth, just to have a little constipation from all the opioids you had. So, okay, and at report this morning, they said that you are strictly breastfeeding. How's that going? You think it's going okay? All right, do you mind if I take a look at your breast? No? Okay. So I'm going to take a look at the right breast. All right. So, yep, I do see a little blistering and redness around your nipples. Are they kind of tender? They are. Okay, so we'll get you some stuff that's called lanolin. It's just a little cream, so you can just put it right on your nipples, and it's going to help heal that cracked skin and just prevent any further damage to that nipple. And also you need to be wearing a nice supportive bra, so when your milk really starts to come in, it might feel a little engorged, and just wearing that bra all day, even while you're sleeping, is going to help ease that pain. So also, next time before you feed your baby next, please just put your call light on, and we will come in and make sure that baby is latching properly. A lot of times that blistering and the cracking on the nipples is because an improper latch. So we'll just help you and make sure that that's going the right way, and it will also help your milk come down easier. So if baby's getting more milk, you're emptying your breast completely, and just really helps prevent any engorgement, okay? So I need to go ahead and take a look at your incision. So I'm going to pull this down. All right, we're going to go ahead and lay you down. All right. Okay, so I'm going to pull this up. Okay, so I see that the surgeon has already removed your dressing, so I just need to check your incision for any redness, ecchymosis, edema, drainage, and approximation, and everything looks good. The wound is intact. Make sure that when you're showering that you just wash with like a mild soap and rinse it off real good, no soaking in the bathtub. And when you get out, just make sure it's nice and dry, and also be on the lookout for any signs of infection like pain, swelling, redness, any discharge. And if that happens, make sure and give your doctor a call. Also be aware if you have a fever over 100.4 to give us a call. Okay, so now I need to kind of push around on your belly just to see how your uterus is returning back to its normal size, and to see how your bleeding is going on your bottom. Okay, so we're going to pull this down. And I would place her in the lithotomy position. Now, when was the last time you changed your pad? About an hour ago. Okay. Make sure and have fresh gloves on, and I would take a look at the pad. I do notice a scant amount of rubra, lochia on there, no clots. So this time we would have a pad laying under her. All right, Shirley, so I'm gonna lift this up. All right, so I place my non-dominant hand right above the pubis. Doing this prevents the uterus from inverting into the vagina, so you want to keep some mild pressure there. Then you massage the top of the fundus right at the umbilicus. So you massage it until it firms up. So yes, it's firming. All right, at this time I want to just press gently down towards the vagina. And I do notice a small amount of rubra lochia with one small quarter-size clot. So, and she is about 1 centimeter below her umbilicus, which is good and normal. So, okay, good. I would go ahead and change all that out, change your pad out. And Shirley, just make sure that when you go home, that if your bleeding returns back to like a bright red, that you give us a call, or if you're expressing any clots larger than an egg, you need to give us a call. And again, with that fever over 100.4, you want to give us a call. Okay, so now we're going to switch to a vaginal birth, clean gloves. Okay, Shirley, so I need to check your episiotomy and see how it's coming along. I'm going to have you flex this leg and just put this arm over, and you're going to roll over. You can hold on to that side rail and help keep your balance. So I would just like gently pull down her panties. You don't want to have to like take them all the way off for this. So gently pull them down. You want to just gently spread the buttocks and take a look at the incision for the episiotomy. Again, you're checking for signs of redness, ecchymosis, edema, drainage, and approximation of the wound. Everything looks good. I do notice some swelling down here. So Shirley, we'll go ahead and get you some ice for that. So we're going to lay you back down. I noticed some hemorrhoids down there. Are those new for you? No, they kind of started during pregnancy. Okay, well that's pretty normal. Are they bothering you? Not really. You're just kind of worried about like when you go to the bathroom next. All right, well, one thing you can do is drink lots of water and make sure you're up and walking around when you feel good. And make sure you add some fiber to your diet. Oh, and also that stool softener that we talked about will definitely help with that. Move things along, just makes it easier to pass. It's not like it's not gonna make you have diarrhea or anything, so don't worry about that. It's just gonna make it easier. So let me just take a look at your legs. How are your legs feeling? Any pain here? Not really. They look a little swollen. Do they feel swollen to you? They do. Yeah, I am noting some 2+ edema on her inferior tibialis area, and some 1+ edema bilaterally in her ankles. Her pedal pulses are strong and equal bilaterally, so that's good. All right, so we will go ahead and get you some compression socks. It's just going to help from keeping that blood from pulling down in your legs, and also you need to be up and moving at least every 2 hours, walk in the halls, and that's also going to help with your constipation. So let me pull this up. Now I need to ask you, how's your vision doing? So that would be up. How's your vision doing? Any like soreness or pressure around your eyes? Nothing like that? Are you seeing any rings around lights, any blurry vision? Nothing like that? Okay, that's good. Okay, so how are you adjusting to motherhood? Everything's going good? Yeah, you seem really happy with your new baby. So one thing that's normal after giving birth is something that we call baby blues, and that's just like a 1 minute you're happy, 1 minute you're kind of sad, but overall you're just kind of happy with life. That's completely normal. It should stop in about a couple weeks. One thing that would worry us though is if those thoughts became persistently negative. If that happens, I want you to call your doctor. And also, if you have any thoughts of harming yourself or your baby, call 911 immediately. Okay, so we're gonna go ahead and go check your medication record, and I will be back for your Tylenol and also with that stool softener that we talked about. So I'll be right back. Perform hand hygiene and leave the room.